Permit me to introduce to you the host of the panel session. Ladies and gentlemen, join your hands together and welcome on stage the Apostle of Joy, the one and only Bolu Onosonya. Please, a round of applause.
Thank you. Good evening, everybody. Are you having a great time? We're going to be discussing autism and everything around autism. And please allow me to just bring up the rest of the panel. We have incredible, amazing people on this panel. And the first of our panelists will be Mrs. Modukbe Williams Odifa. Put your hands together for our panelist, Modukbe Williams Odifa. Thank you for honoring and celebrating her. Next to her would be Dr. Oluwatoba Adebayo Babarisa. Ladies and gentlemen, please put your hands together for Dr. Toba Babarisa. Thank you so much, sir. And the last but not the least is the main man himself, Olufolafumi Abiodun. Ladies and gentlemen, put your hands together for Olufolafumi. You can do that better. That's a convener. Yes, thank you so much for coming here. I'm just going to go right straight to it. We want to learn a little more about autism. So I'm going to go to Mrs. Modukbe here. I want you to tell us about autism. What is autism? What are the symptoms or the signs we must look out for to recognize autism?
So autism or autism spectrum disorder is a neurodevelopmental condition, and it affects people or persons and how they communicate, interact, how they perceive, how they behave within their space and the outer world. It's called a spectrum because it varies widely from here to where. The way it presents, each individual presents itself, it's very different. So that's what autism is about. It's been around for a very long time, and I think it's just that now we're all being aware of it. I'm sure a lot of us grew up when they said, you know, it's I'm sure that was ADHD then, but nobody knew that was what it was. So with autism, you have the verbal and the non-verbal. In our center, we have some students that are non-verbal. They don't have words at all, but it doesn't mean they cannot communicate. There are different ways of communicating. Non-verbal, we have a little poster in school that says, non-verbal doesn't mean I cannot talk, but you need to listen to me more, not only with your ears, but more than your ears, you listen to me. So that's autism. The spectrum is very wide. You have the very high functioning ones. High functioning is like they do everything, they're like you and I, but there are other issues that they can't deal with. And who mentioned anxiety? I think, yes, anxiety is one of them. You have a lot of people that get very anxious. We had prospective students that came to the center for assessment last week and yesterday. He was suffering from a lot of separation anxiety. He wanted his parents to sit down there in the room with him while the assessment was going on, and that couldn't happen because we wouldn't get a true assessment of the situation. Okay?
Thank you so much, Mark. Can you celebrate her? Thank you for your insight and your experience in this field of nurturing people that have autism. And I think it's very critical for us to be able to identify people. And so you're not judging too quickly when you see a child who's not behaving like what you would expect. You know, so you know that, okay, this person is probably dealing with autism, and then you're able to approach the person very differently. And that's the purpose of this kind of awareness, so you know how to relate with other people and how to handle conversations around that. Thank you so much, Ma. I'm going to Dr. Toba now. I want you to give us a medical perspective to this. I want to tell us, you know, what causes autism. You know, what are the causes, and then how do you diagnose as a doctor a person with autism?
Thank you very much, Bolu. Thank you to you, Fola, also for this invite. When he talked about, a friend of yours talked about he was going to come all the way. I thought I was the only one. When Fola was telling me about it, I was like, I'm here already. When is the date? I think you have a very compelling personality, and thank you for bringing us in on this. What causes autism? You know, when I'm in the child and adolescent mental health care clinic, and I'm seeing clients, and probably their caregiver, their parents, that's the burning question on their mind. Because there is some guilt that sometimes come with raising children with autism on their part. Well, whether that should be is part of the conversation we should be having also. And they're just trying to ask themselves, did I do anything wrong? What would have caused it? So it's a burning question. When anybody see a random child that is making a departure from what the norm is, a child that similarly strikes differently, the question on anybody's mind is what is causing it? What caused this? And so in answering that question, I will give it there. It's a simple answer, but I'll also try to simplify it further. There's actually no cause. And for me, and for anyone who has someone living with autism, I think that should be liberating in a sense, because a lot of times when we try to look for causes, we are not helping the situation. You get because we are also trying to curb stigma around autism, and we are moving into there's been a lot of talk around neurodivergence. We are moving into a situation where we are beginning to see these ones as special type of children, unique kind of children. And so when you're asking for a cause, you are looking at it from a problem-based approach. But if for such parents wanting to find closure to what could have happened, we always look at it from a multifactorial perspective, and that's a big English. So I'll break it down. Multifactorial meaning that it's like a recipe of things that come together to cause it. Recipe is also another big word. Well, the great cooks amongst us know that for every good meal, it takes a lot of things stringing together to make it happen. And that's what happens in the case of autism. Unlike when you have a case of sickle cell anemia, I know we're not talking about that yet, when you can say, okay, substitution for glutamic acid, for valine with glutamic acid on chromosome 6 causes the sickle cell abnormality. And when a sickler, when an AS marries an AS, it gives rise to probably 1/3 or more of the children having SS. You can't say that for autism. There is no particular cause. And when we're looking at the multifactorial perspective of it, we say the genetics plays a part and the environment also plays a part. And even in genetics, it's a mixture of several things. So we've noticed some syndromic abnormalities that are associated with autism, from Down syndrome to DiGeorge syndrome to Cree-to-Jad, velocardiofacial syndrome, several. Those are big English. We've also noticed that there are some particular gene or chromosomal abnormalities that are found in those people, some people with autistic disorders. Not necessarily mean that that is the cause, but they've just found an association between some of those genes or some of those chromosomes with people with autistic disorders. Now going to environmental factors, which the relatives or caregivers are more concerned about. Is there anything I did wrong? Again, we found that these things are associated, but not necessarily causative. Let me give you an example. A woman gives birth to her first child at 47 years, and she thinks probably it's because she gave birth to her first child at 47. That is why a child came down with autism. While we found some association with that, especially with late paternal age of conception, that means we have more association of fathers, older fathers, having children coming down with autism, older fathers at conception. We found that there are also old fathers and mothers that give birth to absolutely or to children that don't have autism. So when I say these things, they are just associations and not causes. We've also found issues around the childbirth, issues around perinatal asphyxia or anoxia, where difficult labors or prolonged labors would also be a factor. Of course, smoking, relatively sparsely limited, has also been associated with it, sparsely more with ADHD, but on occasions with autism spectrum. There are a whole lot of them. Well, just low socioeconomic status. So these are environmental factors. Giving birth to children over and over again, not adequate child spaces. They are things that have been associated with autism. But like I said, these things per se are not cause. They are just findings from empirical evidence that juxtapose the occurrence of autism and these situations. Thank you. I'll stop there for now.
Thank you so much for that. And then, did you learn any big word today? Yes, one too many. And one of the things I highlighted from what you just mentioned is that we're not saying, and I saw that when I said normal children, then you stopped. So we're not saying some children are normal and some are not normal. We're saying that we have children who are neurodivergent. So you can be autistic, it's still normal, because now we're not seeing from the problematic point of view, but we're just saying that these people are just different from us. Thank you very much for that insight. Can we put your hands together for him? Now, I'm coming back to you, Ma, and just the conversation you were about to go into where I stopped you. Do autistic children, do they eventually outgrow the symptoms of autism, or do they come into this higher level of functioning, human functioning? We've seen movies, and you've got tremendous experience in this. So, do they outgrow the symptoms, or they just come into this high level of functioning in society?
I'm not going to say they outgrow it. They probably learn strategies to cope with their condition.
Adaptation.
So to help them to be able to cope with all the conditions, the anxiety, and the very, very, very. To us, it's funny, but to them, it's their way of life. And we always say, my staff and I always say, maybe they see us as funny. We are seeing them in one way, but how do they see us? They probably see us as funny as well. And just to protest what Dr. Toby said, in the UK right now, there's a lot of thing about the MMR vaccine, the measles, mumps, and rubella vaccine, that it causes autism. And a lot of people are not taking their children for their vaccinations. Nothing has proven that. Like he said, nobody knows what causes it or what it is. But do they outgrow it? No. They just grow up with support. And that's where early intervention comes in. The earlier, once you've recognized that there is an issue with the child, maybe because they're not listening to you properly, not that they can't hear you, but they're not responding to you, and then that's when you know there is an issue. They might learn to be able to cope with all the anxieties and all the other issues that come with being on that spectrum, but it doesn't mean that they outgrow it. No. It can be cured, it cannot be outgrown, but they live to be able to live a normal life and cope with all the things that they have to cope with in life.
Thank you so much, Ma. I just want to ask one more question. Empirically, we're seeing that there are more children, male children, with autism than female. Is it so in your experience, and
Yes.
is there a reason for it?
Yes, we do. Even at the center, we have more boys, and we see regularly that more boys, and it's been proven statistically that there are more boys that are autistic than girls, and that's just it. It's just been proven statistically. Nobody knows. Nobody knows. Why is it that way with girls and it's not that way with boys? We don't know. But maybe girls are underdiagnosed. We don't know. With more advocacy and more awareness, we might be able to diagnose girls better. We don't know. Everything is like work in progress.
Yes.
As we take steps every day and we discover things every day, we discover strategies that these children can. I'm on a platform, it's called MITRE, and it's Mothers in the Engine Room. And we don't call them special needs children on that platform. We call them wonder children.
Amazing.
That's what we call them on that platform. We call them wonder children. And we meet every Thursday and pray. We just pray for this wonder children. That's what we do. So it's a wide, we get all sorts of, the brilliance we get from some of them is just unbelievable. The memory retention, and the remembrance of everything that they have. They have very good memory. It's unbelievable. The artistic influence that they have on the world as well. I'm sure this last April, which is usually World Autism Month, a young little chap in Abuja did this I can't remember how big the painting was. You remember that? Yes. So we celebrate, at Manor Children's Center, we celebrate World Autism every year in April. But it's from here to there. Our children, the attention span, the anxiety, and them being able to concentrate. A lot of people, it's just concentration. And the behavioral issues, the occupational therapy issues, are because they need that therapy to stimulate them. They learn, and you'll be amazed at what they can remember and what they can read. I have had a student, and he was transited to mainstream. He could read anything. And one day I brought the Financial Times to him, and he read it.
Wow.
He read the Financial Times, and we eventually translated him to. But he was stuck in his ways. Everything had to be symmetrical. Everything had to be a certain way. Yeah. If he was going to do something different that day, we had to be informing him a week or a couple of days before. That, Jeremy, this day, you're not doing this. Because he has his timetable. And he has a book that, the timing is there. They're so set in their ways that if there is a change in plan, we're in trouble in school that day. So we have to also keep our timetable up top notch. And they know it. They don't even have it written down because some of them can't write, but they have it right there in their head. So they are one of the most brilliant individuals that I've met, and loving, very, very, very loving. That's in their ways. Everything has to be this way, and it's this way. They can arrange trains from here to there, and it's so symmetrical. and it won't move out of place. But when it moves out of place, you're in trouble. So you need to learn these unique characteristics that they have to be able to get along with them, and for them too to be comfortable in the environment that they're in.
Wow, superb insight. Can you please put your hands together for her? Thank you so much, Ma. She mentioned something very critical, that early intervention helps. So when you maybe have a child around you that you just see the patterns, early intervention can help such a child. Just like she mentioned, there was a child that was transitioned into, it's possible for even neurodivergent children to actually experience that as well. So early intervention is very, very critical. Now I want to go to Olufola on this one, the music man. And your work with Cadenza is superb, is unique, is amazing. Yes, you want to put your hands together for Cadenza Care Initiative? Yes. And as a musician, I want to ask you, what's the power of music? You go there and use sound therapy or music therapy as a form of therapy. What is that about? And how does that help? What kind of improvements have you seen with your work?
All right, thank you very much. I'll make this very short because of time. Okay, I wish I had time, though. At Cadenza Care Initiative, we have found that sound and music can do far more than entertainment. It can heal, calm, and connect. For autistic children, music often becomes like a means for communication where words are not necessary, but communication still happens. We've seen amazing things that our sound does, and we've been able to design sounds to help them improve focus and emotional balance. Over time, we've seen children who were once withdrawn begin to engage more socially, regulate their emotions better, and improve their speech and cognition. Music has a way of breaking down barriers, and in many cases, it does better than traditional methods.
Amazing. You try to keep it short because I know
trying
there's
to.
so much.
I
There's so
try.
much in, and I want you to pay attention to this. That when she was speaking, she mentioned the environment. When Dr. Toba was speaking as well, he mentioned the environment and how critical it is for neurodivergent children, especially the autistic ones. And he now talks about the music, and the music forms some level of environment. Do you want to? I could borrow you a minute to talk to that.
All right, so our bodies are literally like an instrument. Our eyes, our heartbeat, everything resonates what sound is. The drum, the keyboard, that's why every instrument has its feeling. If violin sounds melancholy, the drum imitates the heartbeat, right? The piano, soul, everything has something to do with your body, right? So for what we do, we create sounds that are tailored to do certain. So let's say it could be for an autistic child that has low functionality, right? Then we research frequencies that help the mind, right? Engages the mind. So it's a spectrum of sound we also go through, and most of this, it's a journey for me also because I make most of the sounds because I would have to be in the midst of them, understand them, go to my safe space and create these things. And sometimes this sound takes 3 months, 6 months because you have to really be intentional. It's like you have to know the right ingredients for the sound.
Yeah.
But the extent of what music can do, we're actually working on getting Cadenza to the point where we can cure cancer with sound. That's where we're even going to. So we're just starting.
Thank you so much.
Can I just add something?
Yes.
In our occupational therapy room, we have a project. It's called the Listening Project, and we got it from the United States. But it is about music and its sound. And when we have a child that has a meltdown at the center, one of the things we do is take them into the OT room on them, and then we put on the listening program. And the first time we heard about it, and we decided we would use it at Manatee Children's Center, and then we ordered it, and it came, and I thought, let me even listen to what they listen. He was just lovely sounding of the waves, that the children. And the first child we used it on, she so calmed down from the meltdown. We didn't know what the cause of the meltdown was at the time, and so we would take her into the occupational therapy room, the music, the music. Program on her. The listening program is called. We put it on her. And that's how we got her to be able to calm down and actually be able to concentrate on things. Now she can sit down and do a whole puzzle, on her own, sometimes without help or without support. So yes, we do music therapy. You've been to us and you've been, yeah.
Amazing.
We do music therapy, occupational therapy, speech therapy, and hydrotherapy.
Fantastic.
Swimming is very important for the muscles.
Yeah.
And yes, we do that for the children as well. So I
Thank you
You
so
should
much.
come and listen to our listening program.
I definitely will.
Yes.
Just to put a balance to everything, and we'll talk about therapy. So, like they've all said, therapy is the mainstay of care.
Yeah.
You understand? And but it's always important that like she has said, that early intervention, and people have difficulty intervening early because they don't even know the soft signs. You understand? Difficulty with, you see a child that is having difficulty with social interaction. This child is already 3 years, and you expect by 3 she should be able to say, "Mom, Dad, interact with you, talk, smile at you, smile back, chase after your child, pick a ball." And the child is just finding difficult interacting with other children, prefers to be alone, just likes to stay all by himself, all by herself.
No eye contact.
No eye contact. You get having difficulty with their language. And one thing she kept mentioning, this, we call it this restrictive, repetitive pattern of behavior. They just have a way of doing things that they don't want altered. They arrange their stuffs in a straight line. They want to eat a particular kind of food. They just want to eat rice, without any stew, nothing else. They are very sensitive to the environment. If you put an autistic child here, you might find him to be very cranky, because they are very sensitive to bright light or low light. They are sensitive to running water. So you must look out for all, there are quite a number of them, but you must look out for those cardinal things: poor social interaction and a restricted pattern of behavior. And then when you identify, seek the help of a doctor or mental health specialist, a therapist. Thank you very much.
Thank you so much. Just to wrap up, I want us to just, and the reason why I really went on you to say what you said about music is because by way of inclusion, if you realize that you have that kind of behavior, you just want your things in one place, or perhaps you just feel like sometimes some sounds are just noise to you, what we're talking about is an extreme part of a spectrum. Many of us exhibit some of these traits. Do you see it? So don't be too quick to judge another person and say, "Oh, that's autistic." Yeah. No, just not to that far of the spectrum, right? So that's why you listen to music and it's soothing to you. Do you see it? So just the same way you pay attention to yourself and the way you behave, we're paying attention to other people as well. And we're able to give them more room, more grace, more warmth so that they can enjoy life better. Thank you so much for such a rich conversation. Can we celebrate it, panel? Ladies and gentlemen, come on, celebrate your panel.
Hey, please, ladies and gentlemen, not all disabilities is visible. Sometimes you can't see it, but it's there. So we need to learn to be kind. Thank you.